There has been a significant increase in new infections as well as hospitalizations due to a third wave of the COVID-19 pandemic. In the past 24-hour cycle, 7,657 new COVID-19 cases were recorded. Now, the pressure on hospitals automatically leads to pressure on the healthcare workers themselves. For more on the effects of the third wave on nurses, I'm joined by Sicina, a nurse and general secretary of the Young Nurses Indaba Trade Union. Mrs. Sicina, a very good afternoon to you. Good to have you with us. Now, we have officially entered the third wave. The number of hospitalizations has increased. Is this causing a burden on the nurses and the entire infrastructure?
Definitely. Thank you, Sister Tammy, for having Wainito on your show. Definitely, it is causing a strain, and it is also causing more frustration. Remember, we've uttered it before as Young Nurses in our trade union to say public healthcare system in South Africa, even private, in that case, we have never been ready for any pandemic because we are failing. The system was failing under normal circumstances. At the moment, the minute our biggest problems in South African public healthcare system is infrastructure, gross shortage of material resources, and gross shortage of human resources. And all these things are inversely proportional to the growth of the population in our country. So the admissions, remember, even the normal illnesses didn't decide to take a back seat and say we are going to wait for the pandemic to end, then we will come back. We are still admitting people who need to be admitted and get proper treatment. As a result, many of them are seen and discharged because we need to open a space for those who are admitted because of COVID-19 related illnesses. Wards, like in each and every ward, in Gauteng in particular, that has like 2 wards that are designated to admit COVID-19 patients. They are full. Almost all of them, they are full because we admit patients who are under investigation until we discover whether they are positive or not positive. So we have wards who have confirmed the positive patients and those who are still under investigation. That simply means each and every hospital must have extra infrastructure. Where is that infrastructure? It simply means we are robbing system to pay rich. It's a situation where substandard performance and mediocre has been normalized.
How does this current scenario measure up to the second wave of COVID-19 as well as the first wave?
When we are looking as Young Nurses Indaba, when we are looking at the alarming rate and the skyrocketing numbers, we're even saying, no, you know what? We are calling for stricter lockdown regulations. All areas of mass gatherings must be closed. We must go back to a level that is going to at least restrict many people. Schools must be shut down because we are seeing, Sister Tammy, again a situation where elders are admitted. Like it's crazy. They are admitted because we believe young ones, the youth, us in particular, we go to these mass gathering areas, we contract viruses. Kids go to school, they contract viruses, and kids usually never present with symptoms, and they come back to their elders and they infect them. And the elders, because they are immunocompromised by virtue of them being elders, others have comorbidities like underlying conditions. It's easy for them to react badly or negatively to the infection, and they are admitted, and they are causing the strain to the healthcare system. And we see ourselves going to the way it was hit hard, the healthcare system by second wave in particular. We see ourselves going there again.
And what about the availability of personal protective equipment? Do you have enough of that now? Is there enough in stock?
Where we are sitting, we have a situation, Sister. Let's put it straight, it's not enough. It is not enough in stock because we are in a situation where the entire hospital, they will say we are not going to give everyone COVID-19 PPE, for example, but they are going to choose those COVID-19 designated wards, not taking into consideration the fact that everyone in each and every unit, if you can test all of them, you will surely find 3 or 4 people who are going to test positive. So it simply means each and every unit, each and every ward, all those nurses working in those particular units need to have this PPE, but because they are controlling the fact that it might just we might just run out of it. So look at what has happened with corruption, and in as far as procurement of PPE is concerned. So we are using it sparingly with the fear that should we hit hard by COVID-19, we'll find ourselves toying again, running around and begging for protective personal protective equipment. So it is not enough, since not everyone is given this PPE.
The Sicina study is now done, and all health workers are supposed to have been vaccinated. Have you been vaccinated, and what is the general sentiment among the young nurses, Indaba Trade Union, and nurses in general about the state of vaccination?
We also said it, Sister Tammy, at the beginning of this COVID-19 vaccine rollout, to say the government on the country in particular is not going to reach or achieve its herd immunity. Why? Because there is still skepticism on the ground. There's still mistrust on the ground. Healthcare professionals in particular, I'm one of them, that said, I'm not going to take this vaccine, more especially when we were told that it's on a trial mode, and we see a situation where we were given Johnson & Johnson with 57% efficacy level, while we have like better vaccines out there with 92% efficacy level. So we were saying, are they using us as to make profit? Why specifically certain vaccines why specific certain vaccines are chosen over others? So because us as healthcare professionals, we have a toxic relationship with our employer. It simply means, we were saying as young nurses in Dubai, we can as healthcare professionals assist government in terms of distributing information and demystifying conspiracy theories out there, educating the public to say, and according to us, because we are champions of vaccines and immunizations, but because this one was half cooked, it was created in 7 months, there was a lot of work that needed to be done. As a result, many healthcare professionals, Sister Me, have refused to say, we are not going to take it. We were thrown into the deep end. We managed to swim against the tide. And just imagine if healthcare professionals are saying we are not taking the vaccine. What about ordinary people on the ground?
So which vaccine then, Rich, would you be comfortable in taking?
Sister, there was a talk of South Africa having to go to Russia and get Sputnik, which was a 92% efficacy level. But that one was swept under carpet. We do not know the reason. And at some point, we were reading articles saying Dr. William Kiza and Comrade Cyril Ramaphosa are not seeing eye to eye, because the other wants Johnson & Johnson, while the other one saying, but Johnson & Johnson is not going to help us with like the way we want it to be. Let's go for the one with a higher efficacy level. That is why we were pushing, not necessarily that we are choosing a certain vaccine because it's from a certain country. No, we are saying we are champions of vaccine. Don't give us a 57 while we have a 92 efficacy level vaccine sitting out there that can really come and at least demystify and bring trust to those who are going to receive this vaccine.
So let me ask you now, with the measures that government has put in place and the lockdown level that we are at, do you believe that this is sufficient in order to control the number of hospitalizations that the country is currently experiencing?
They are not sufficient, Sister. Remember, more especially because we were talking about the infrastructure. The infrastructure is some of our healthcare facilities are just dilapidated, and the others that are existing, the capacity is inadequate. We found ourselves in a situation where we were putting tents Really, we were preparing to admit and have patients spending more than 24 hours in tents. So all these measures that have been put out there are not enough. It's worse in Gauteng system. More especially, there's not even an extra ward, at least or 2 or 3 wards in each and every facility. Those wards that were added, that didn't happen. It's worse now. We are going to.
I'm trying to understand, Rich, what resources are available from the first and second waves that can now be utilized now? Are you saying that we are pretty much in the same position that we were in level 1 of the lockdown? I'm thinking that there should be some sort of progress that has been made over the past year or so as far as infrastructure is concerned and as far as the availability of the right beds that you need and the oxygen tanks, everything that you need for COVID-19 patients and treatment.
Sister, I often say I'm the General Secretary of a union, but I'm not working from the office. But I work in a hospital and I'm doing bedside nursing. I see the atrocities every day. The South Africa hasn't moved even an inch. There is no additional facility. That is why I was trying to say it's worse with Gauteng, more especially because Charlotte Maxeke now is not functioning, and there's not even an indication when we will start functioning. So in as far as infrastructure, in as far as resources, in as far as everything that government was supposed to put out there, at least to make us be ready for third wave and going forward, no, we are still in the same position as first wave, second wave, and we are still in that particular position now facing the third wave. We are still complaining about gross shortage of that system. It's a disgrace in this country that in a pandemic like this, a pandemic that affects healthcare system, we still have nurses who are unemployed, nurses who are relying on us, calling them for amatoho. It's really a disgrace. We still have a situation system where we are not taking patients in our facilities to theater or to ICU because there's no bed in ICU. We're still having a situation where if there is a bed in ICU, there's no nurse to nurse that particular patient. As a result, go to our emergency facilities, our emergency areas, go to casualty. You'll find a lot of patients. Others spend as far as 5 to 7 days in that emergency area only because the facility is full. You are waiting for a particular person to be discharged or to die until you go and be admitted as well. It's just we haven't moved an inch. Our government has failed all of us.
Mr. Sicina, definitely not encouraging news at all, but certainly the day-to-day experiences that you, as you say, have personally seen and those within your facility. That's Mr. Rich Sicina. He is a nurse as well as the General Secretary of the Young Nurses Indaba Trade Union, talking about the impact of the third wave of COVID-19 on hospitalizations. And as he says, that we have not moved, not much from phase 1 or phase 2 can be taken to be applied for this current phase that we're in, according to him.